Here at Rush, we are able to offer the entire spectrum of treatment options for the most challenging patients, which means we work together as a team, not only urology, but also other specialty, to try to maximize always the benefit for the patient, minimize the risks.
What we have here at Rush Urology is the full spectrum of surgical specialists, not only using the robot, but also involved with infertility, male reconstructive urology, female pelvic floor reconstructive urology, stone disease, advanced treatments for benign prostate disease. So across the entire spectrum, including robotics in the treatment of cancer and reconstruction like vaginoplasty and other gender affirmation surgeries. It's a great honor to be part of the multidisciplinary team in gender affirmation here at Rush. So what we're offering robotically is robotic vaginoplasty. Using the robot allows for the creation of the appropriately length vagina that's functional. It also allows the opportunity to use bowel, whether that's large intestine or small intestine, to create the right kind of channel to make a functional sexual organ.
Innovation is important. It's a philosophy of mine when I talk about patient care, because ultimately it's about how can we treat the patient while minimizing any side effects from treatment. And I use a robot for oncology, for reconstruction. We have 5 multi-port robots, and we also have 1 single-port robot. And so essentially it has almost become routine. We use it on a daily basis. Within the last couple of years, I believe the most groundbreaking thing that we've applied it to is to be able to use a single incision robot, or also known as a single port robotic platform, to perform surgery for kidney cancers and prostate cancers. Using only 1 incision allows us to stay out of important structures like the space where the bowel is contained. It really minimizes complication. It helps with pain control afterwards, and it allows us to send selected patients to go home the same day.
I think that when you utilize these new tools, you can bring a lot of advantages to the tables for the patients. And what I'm finding is that there are some patients where you were really trying with the old tool or the more established tools to make it work when it wasn't an ideal situation. Maybe someone had a lot of abdominal surgery and whatnot, and now we're able to do maybe an end run around that and stay out of the peritoneum, avoid all of that additional surgery, and do a retroperitoneal case or do an extraperitoneal case and save them the suffering of potential injury to the bowel or other problems, and really allow them to have a quicker recovery and accomplish a very similar outcome.
Robotic cystectomy is certainly one of the most advanced and challenging procedures we do in urology. The nice thing about robotic technology is that besides having a 3D view, it will also maximize the precision of my movements. That will increase the safety of the procedure, will increase the precision of each step of the procedure, will minimize the risk of complication, and overall it will make a better surgery.
When it comes to female pelvic reconstruction, women want to have options. So at Rush, we offer vaginal surgeries, ablative procedures, and also robotic surgeries. And depending on what a woman is looking for, right, they might want the most minimally invasive option, they might want the most durable option, and so we can offer all these things and tailor to a woman's best needs. Female pelvic reconstructive surgery is really amenable to the single port. It's a great option for sacrocolpopexy procedures, for pelvic organ prolapse. It's also great for any kind of bladder reconstruction work that we do. And it's a really easy recovery. It's cosmetic. Women seem really happy with it, and the recovery has been pretty easy.
We're all excellent surgeons, we're all excellent clinicians, but one of the things that we're tackling at an academic center such as Rush is we're really pushing the envelope with trying new things. When someone has 1 tumor, you don't need to come to an academic center, you can. But like, when somebody has 7 tumors in 1 kidney, that's what I do. That's what we can do. And so that's something that is going to be hard for anyone, but it is an opportunity for us to practice our craft and then also teach it and send it on the way, and then utilize the newest tools in order to do that job.
As an institution, Rush is really committed to pursuing talent as it relates to robotic surgery. So through the years, we've brought on robotic experts in thoracic surgery and plastic reconstruction, and it's really important to bring all these talent and innovation to Rush. And as a result of that, we've learned a lot, and we've really been able to offer complex surgery to these patients.
It's a real pleasure being a high-ranking program like Rush in urology. I get to work with the best colleagues in the country at what they do surgically and medically for the treatment of urologic disease. It also allows for recognition in the community and allows patients to know that what we're offering them is amongst the best in the country.